81. A nurse is assessing a patient with COPD. Which finding indicates possible CO2 retention? A. Oxygen saturation of 92%. B. Drowsiness and lethargy. C. Clear lung sounds. D. Heart rate of 76 beats per minute. Answer: B. Drowsiness and lethargy. Rationale: drowsiness and lethargy suggest hypercapnia, CO2 retention, as elevated CO2 levels depress the central nervous system in COPD patients. Option A, 92% saturation, is within the target range and unrelated to CO2. Option C, clear lung sounds, is atypical in COPD and not specific to hypercapnia. Option D, heart rate of 76, is normal and not indicative of CO2 retention. 82. A patient with COPD is prescribed fluticasone. What should the nurse teach the patient to do after using this inhaler? A. Hold their breath for 5 seconds. B. Rinse their mouth with water. C. Exhale forcefully immediately. D. Take a second dose right away. Answer: B. Rinse their mouth with water. Rationale: fluticasone, an inhaled corticosteroid, can cause oral candidiasis, so rinsing the mouth after use is essential. Option A is incorrect, as holding breath for 10 seconds is standard, but 5 seconds is insufficient. Option C is incorrect, as forceful exhalation expels medication. Option D is incorrect, as dosing follows a prescribed schedule. 83. The nurse is caring for a patient with COPD who reports frequent nighttime awakenings. What is the most likely cause? A. High blood sugar levels. B. Nocturnal hypoxemia. C. Medication side effects. D. Excessive fluid intake. Answer: B. Nocturnal hypoxemia. Rationale: nocturnal hypoxemia, common in COPD due to hypoventilation during sleep, disrupts sleep and causes awakenings. Option A, high blood sugar, is unrelated unless diabetes is present. Option C may contribute, but is less likely without specific medications, e.g., theophylline. Option D is incorrect, as fluid intake doesn't directly affect sleep in COPD. 84. Which instruction should the nurse give a patient with COPD to improve nutrition? A. Eat 3 large meals daily. B. Choose high-fat foods only. C. Rest before eating to reduce dyspnea. D. Avoid protein to ease digestion. Answer: C. Rest before eating to reduce dyspnea. Rationale: resting before meals conserves energy, reducing dyspnea and improving eating ability in COPD patients. Option A, large meals, may cause gastric distension, worsening breathing. Option B is incorrect, as a balanced diet is needed, not just fats. Option D is incorrect, as protein supports respiratory muscle strength. 85. A patient with COPD is experiencing an exacerbation. Which finding requires immediate intervention? A. Respiratory rate of 20 breaths per minute. B. Oxygen saturation of 85%. C. Sputum production of 2 tablespoons. D. Blood pressure of 130/80 mmHg. Answer: B. Oxygen saturation of 85%. Rationale: an oxygen saturation of 85% indicates severe hypoxemia, requiring immediate intervention, e.g., oxygen adjustment, bronchodilators, to prevent respiratory failure. Option A, respiratory rate of 20, is mildly elevated but less urgent. Option C, sputum, is common in exacerbations but not critical. Option D, blood pressure, is normal. 86. The nurse is teaching a patient with COPD about smoking cessation. Which resource is most appropriate to recommend? A. A local gym membership. B. A smoking cessation support group. C. Over-the-counter herbal remedies. D. A high-protein diet plan. Answer: B. A smoking cessation support group. Rationale: a support group provides peer encouragement and strategies for quitting smoking, the most effective way to slow COPD progression. Option A, gym, supports fitness but not cessation directly. Option C is unreliable without evidence. Option D is unrelated to smoking. 87. A patient with COPD has a PaO2 of 60 millimeters of mercury. What should the nurse do first? A. Increase oxygen to 4 liters per minute. B. Notify the healthcare provider. C. Encourage deep breathing exercises. D. Administer a diuretic. Answer: B. Notify the healthcare provider. Rationale: a PaO2 of 60 millimeters of mercury indicates hypoxemia, requiring medical evaluation to adjust oxygen or other therapies safely, as COPD patients risk CO2 retention with high oxygen. Option A is incorrect without a prescription. Option C may not address severe hypoxemia. Option D is irrelevant to hypoxemia. 88. Which finding indicates a patient with COPD is tolerating oxygen therapy well? A. Cyanosis of the fingertips. B. Oxygen saturation of 90%. C. Increased confusion. D. Respiratory rate of 28 breaths per minute. Answer: B. Oxygen saturation of 90%. Rationale: an oxygen saturation of 90% is within the COPD target range, 88 to 92%, indicating effective therapy without CO2 retention risk. Option A, cyanosis, suggests hypoxemia. Option C, confusion, indicates possible hypercapnia or hypoxemia. Option D, tachypnea, suggests respiratory distress, not tolerance. 89. The nurse is planning care for a patient with COPD. Which intervention promotes effective airway clearance? A. Limiting fluid intake to 1 liter daily. B. Encouraging postural drainage. C. Administering a beta blocker. D. Reducing physical activity to rest. Answer: B. Encouraging postural drainage. Rationale: postural drainage uses gravity to mobilize mucus, improving airway clearance in COPD patients with secretions. Option A thickens mucus, hindering clearance. Option C, beta blocker, may worsen bronchospasm. Option D promotes deconditioning, not clearance. 90. A patient with COPD asks why they feel short of breath even at rest. What is the nurse's best response? A. Your lungs are trapping air, making breathing harder. B. You're likely dehydrated and need more fluids. C. Your heart isn't pumping enough blood. D. Your medications are causing this feeling. Answer: A. Your lungs are trapping air, making breathing harder. Rationale: air trapping from obstructed airways in COPD reduces effective ventilation, causing dyspnea even at rest. Option B, dehydration, is unrelated to resting dyspnea. Option C, heart failure, requires confirmation and isn't the primary cause. Option D is incorrect unless specific medications are known to cause dyspnea. 91. A patient with COPD is prescribed a combination inhaler with salmeterol and fluticasone. What should the nurse monitor for? A. Hyperglycemia. B. Oral thrush. C. Hypotension. D. Weight loss. Answer: B. Oral thrush. Rationale: fluticasone, a corticosteroid, can cause oral thrush, requiring monitoring and teaching about mouth rinsing. Option A, hyperglycemia, is unrelated to inhaled medications. Option C, hypotension, is not a common side effect of salmeterol. Option D, weight loss, is less likely than with oral corticosteroids. 92. The nurse is assisting a patient with COPD in pulmonary rehabilitation. Which exercise is most appropriate? A. Sprinting for 30 seconds. B. Arm raises with light weights. C. Deep knee bends. D. Jumping jacks. Answer: B. Arm raises with light weights. Rationale: arm raises with light weights build upper body strength safely, improving respiratory muscle endurance in COPD. Option A, sprinting, is too intense. Option C, knee bends, may strain breathing. Option D, jumping jacks, risks dyspnea due to high energy demand. 93. A patient with COPD reports unintentional weight loss. What should the nurse assess first? A. Daily calorie intake. B. Respiratory effort. C. Blood glucose levels. D. Fluid intake. Answer: B. Respiratory effort. Rationale: Increased respiratory effort in COPD raises metabolic demand, contributing to weight loss, so assessing breathing work is the priority. Option A, calorie intake, is secondary but relevant. Option C, glucose, is unrelated unless diabetes is suspected. Option D, fluids, is less directly linked to weight loss. 94. Which statement by a patient with COPD indicates a need for further teaching about exacerbation triggers? A. I'll avoid cold weather to protect my lungs. B. I'll keep using my wood-burning fireplace. C. I'll stay away from people with colds. D. I'll monitor my symptoms daily. Answer. B. I'll keep using my wood-burning fireplace. Rationale. Wood-burning fireplaces produce smoke, an irritant that can trigger COPD exacerbations, indicating a misunderstanding. Options A, C, and D are correct. Avoiding cold air, sick contacts, and monitoring symptoms help prevent exacerbations. 95. The nurse is assessing a patient with COPD for signs of polycythemia. Which finding is most indicative? A. Hemoglobin of 18G/DL. B. Heart rate of 88 beats per minute. C. Pale skin tone. D. Low blood pressure. Answer. A. Hemoglobin of 18G/DL. Rationale. Polycythemia, a compensatory response to chronic hypoxemia in COPD, elevates hemoglobin, e.g., 18G/DL, to increase oxygen carrying capacity. Option B, heart rate, is normal. Option C, pale skin, suggests anemia, not polycythemia. Option D, low blood pressure, is unrelated. 96. A patient with advanced COPD asks about hospice care. What is the nurse's best response? A. Hospice is only for cancer patients. B. It focuses on comfort when treatment goals change. C. It means stopping all your medications. D. You're not sick enough for hospice yet. Answer. B. It focuses on comfort when treatment goals change. Rationale. Hospice care prioritizes comfort and quality of life for patients with terminal illnesses like advanced COPD when curative treatment is no longer the goal. Option A is incorrect as hospice applies to many conditions. Option C is incorrect as medications continue for symptom relief. Option D assumes prognosis, without assessment. 97. The nurse is teaching a patient with COPD about oxygen therapy at home. Which instruction is most critical? A. Use oxygen only during exercise. B. Secure oxygen tanks to prevent tipping. C. Store extra tanks in a closet. D. Turn off oxygen when not in use. Answer. B. Secure oxygen tanks to prevent tipping. Rationale. Securing oxygen tanks prevents them from falling, which could cause injury or damage, making it a critical safety measure. Option A is incorrect as oxygen use follows a prescription. Option C is acceptable but less urgent. Option D is incorrect as continuous use may be required. 98. A patient with COPD is prescribed roflumilast. What should the nurse teach the patient to report? A. Improved appetite. B. Mood changes or depression. C. Increased sputum production. D. Better exercise tolerance. Answer. B. Mood changes or depression. Rationale. Roflumilast can cause psychiatric side effects, such as mood changes or depression, which should be reported promptly. Option A, improved appetite, is not a concern. Option C, sputum, is expected in COPD and not specific to roflumilast. Option D, exercise tolerance, is a positive outcome, not a side effect. 99. Which position should the nurse recommend for a patient with COPD to ease breathing at rest? A. Lying flat with knees bent. B. Leaning forward with elbows on a table. C. Side lying with head elevated. D. Supine with arms at sides. Answer. B. Leaning forward with elbows on a table. Rationale. Leaning forward, tripod position, opens the chest and supports accessory muscles, easing breathing in COPD. Option A restricts lung expansion. Option C is less effective for dyspnea relief. Option D limits diaphragm movement, worsening breathing. 100. The nurse is evaluating a patient with COPD after teaching about medication use. Which action indicates understanding? A. Taking bronchodilators only when symptomatic. B. Using a spacer consistently with inhalers. C. Storing inhalers in a hot car. D. Skipping doses to save medication. Answer. B. Using a spacer consistently with inhalers. Rationale. A spacer improves medication delivery to the lungs, enhancing effectiveness and showing proper technique. Option A is incorrect as bronchodilators are often scheduled. Option C risks degrading medication. Option D leads to poor symptom control. 101. A nurse is assessing a patient with COPD. Which finding suggests worsening hypercapnia? A. Increased alertness. B. Tremors and irritability. C. Oxygen saturation of 89%. D. Respiratory rate of 16 breaths per minute. Answer. B. Tremors and irritability. Rationale. Tremors and irritability indicate hypercapnia, elevated CO2, as high CO2 levels affect the nervous system, causing neurological symptoms. Option A, increased alertness, suggests improved oxygenation, not hypercapnia. Option C, 89% saturation, is within COPD target range and unrelated to CO2. Option D, respiratory rate of 16, is normal and not specific to hypercapnia. 102. A patient with COPD is prescribed albuterol via nebulizer. What should the nurse monitor during administration? A. Blood glucose levels. B. Heart rate for tachycardia. C. Urine output. D. Skin turgor. Answer. B. Heart rate for tachycardia. Rationale. Albuterol, a beta agonist, can cause tachycardia as a side effect, requiring heart rate monitoring. Option A, glucose, is unrelated to albuterol. Option C, urine output, is not affected. Option D, skin turgor, is irrelevant to nebulizer use. 103. The nurse is teaching a patient with COPD about managing dyspnea. Which technique is most effective? A. Rapid shallow breathing. B. Pursed lip breathing. C. Holding breath for 15 seconds. D. Coughing forcefully. Answer. B. Pursed lip breathing. Rationale. Pursed lip breathing prolongs exhalation, reduces air trapping, and eases dyspnea in COPD patients. Option A. Rapid breathing. Worsens dyspnea. Option C. Holding breath, is uncomfortable and ineffective. Option D. Coughing, aids mucus clearance, but not dyspnea relief. 104. A patient with COPD asks how to prevent exacerbations during winter. What is the nurse's best response? A. Stay indoors with windows closed. B. Increase fluid intake to 4 liters daily. C. Avoid wearing scarves over the mouth. D. Stop using inhalers until spring. Answer. A. Stay indoors with windows closed. Rationale. Staying indoors with windows closed reduces exposure to cold air and pollutants, common exacerbation triggers. Option B. Excessive fluids, risks fluid overload. Option C is incorrect as scarves warm inhaled air, helping breathing. Option D is dangerous as inhalers are essential for symptom control. 105. A patient with COPD has a new onset of wheezing. What is the nurse's priority action? A. Administer a diuretic. B. Assess lung sounds and oxygen saturation. C. Encourage fluid restriction. D. Place the patient in a supine position. Answer. B. Assess lung sounds and oxygen saturation. Rationale. New wheezing suggests bronchospasm or exacerbation, so assessing lung sounds and oxygen saturation determines severity and guides intervention. Option A, diuretic, is irrelevant. Option C, fluid restriction, may thicken mucus. Option D worsens breathing by limiting lung expansion. 106. The nurse is planning care for a patient with COPD. Which goal is most appropriate for activity tolerance? A. Run 1 mile without stopping. B. Walk 100 feet with minimal dyspnea. C. Avoid all physical activity. D. Lift 20 pounds daily. Answer. B. Walk 100 feet with minimal dyspnea. Rationale. Walking 100 feet with minimal dyspnea is a realistic goal, improving endurance without overexertion in COPD. Option A, running, is unrealistic due to oxygen demands. Option C, promotes deconditioning. Option D, lifting, risks dyspnea and is less feasible. 107. A patient with COPD is prescribed tiotropium. What should the nurse teach about its use? A. Use it every 2 hours for acute symptoms. B. Inhale it once daily for maintenance. C. Expect sedation as a side effect. D. Stop it if sputum increases. Answer. B. Inhale it once daily for maintenance. Rationale. Tiotropium, a long-acting anticholinergic, is used once daily to prevent symptoms, not for acute relief. Option A is incorrect, as it's not a rescue inhaler. Option C is incorrect, as sedation is not a side effect. Option D is incorrect, as increased sputum requires evaluation, not stopping medication. 108. A patient with COPD reports feeling socially isolated. What is the nurse's best intervention? A. Suggest limiting family visits. B. Encourage joining a COPD support group. C. Recommend avoiding public places. D. Advise stopping pulmonary rehabilitation. Answer. B. Encourage joining a COPD support group. Rationale. A COPD support group provides social connection and shared experiences, reducing isolation. Option A worsens isolation. Option C is unnecessary unless infection risk is high. Option D is incorrect, as rehabilitation improves physical and emotional health. 109. The nurse is assessing a patient with COPD for signs of respiratory distress. Which finding is most alarming? A. Use of accessory muscles. B. Sputum production of 1 tablespoon. C. Heart rate of 82 beats per minute. D. Oxygen saturation of 91%. Answer. A. Use of accessory muscles. Rationale. Accessory muscle use indicates significant respiratory distress as the patient struggles to breathe against obstruction. Option B, sputum, is common and less urgent. Option C, heart rate, is normal. Option D, 91% saturation, is within COPD target range. 110. A patient with COPD asks why oxygen is set at a low flow rate. What is the nurse's best response? A. High flow can worsen your CO2 retention. B. Low flow saves oxygen for later use. C. It prevents your lungs from drying out. D. High flow causes low blood pressure. Answer. A. High flow can worsen your CO2 retention. Rationale. In COPD, high oxygen flow can suppress respiratory drive, leading to CO2 retention, so low flow, e.g., 1 to 2 liters, is used. Option B is incorrect, as conservation isn't the reason. Option C is incorrect, as humidifiers prevent drying. Option D is unrelated to oxygen flow. 111. A patient with COPD is prescribed budesonide. What should the nurse monitor for? A. Hypokalemia. B. Hoarseness or sore throat. C. Bradycardia. D. Weight gain. Answer. B. Hoarseness or sore throat. Rationale. Budesonide, an inhaled corticosteroid, can cause hoarseness or sore throat due to local irritation, requiring monitoring. Option A, hypokalemia, is unrelated. Option C, bradycardia, is not a side effect. Option D, weight gain, is more common with oral corticosteroids. 112. The nurse is assisting a patient with COPD in planning daily activities. Which strategy is most effective? A. Complete all tasks without breaks. B. Pace activities with rest periods. C. Schedule exercise only at night. D. Avoid using assistive devices. Answer. B. Pace activities with rest periods. Rationale. Pacing with rest periods conserves energy, reducing dyspnea and fatigue in COPD patients. Option A leads to exhaustion. Option C limits flexibility and may disrupt sleep. Option D is incorrect, as devices like walkers reduce energy expenditure. 113. A patient with COPD reports a productive cough. What should the nurse assess first? A. Sputum color and consistency. B. Recent meal intake. C. Blood pressure. D. Skin temperature. Answer. A. Sputum color and consistency. Rationale: sputum color and consistency indicate infection, e.g., yellow-green suggests bacteria, guiding intervention in COPD. Option B, meals, is unrelated to cough. Option C, blood pressure, is secondary. Option D, skin temperature, may indicate fever but is less specific than sputum. 114. Which statement by a patient with COPD indicates understanding of infection prevention? A. I'll avoid my pneumococcal vaccine. B. I'll clean my nebulizer equipment daily. C. I'll stop my inhalers during a cold. D. I'll visit friends when they're sick. Answer: B. I'll clean my nebulizer equipment daily. Rationale: daily cleaning of nebulizer equipment prevents bacterial growth, reducing infection risk. Option A is incorrect as vaccines are critical. Option C is incorrect as inhalers should continue. Option D increases infection exposure. 115. A patient with COPD is hypoxic despite oxygen at 2 liters per minute. What should the nurse do next? A. Increase oxygen to 6 liters per minute. B. Notify the healthcare provider. C. Encourage rapid breathing. D. Remove the oxygen cannula. Answer: B. Notify the healthcare provider. Rationale: persistent hypoxia requires medical evaluation to adjust oxygen or other therapies safely, avoiding CO2 retention. Option A is unsafe without orders. Option C may worsen dyspnea. Option D risks worsening hypoxemia. 116. A patient with advanced COPD discusses fears about dying. What is the nurse's best response? A. Let's focus on your treatment instead. B. Can you share what's worrying you? C. You're not at that point yet. D. Everyone feels scared sometimes. Answer: B. Can you share what's worrying you? Rationale: inviting the patient to express fears fosters emotional support and identifies needs for palliative care, respecting their concerns. Option A avoids the issue. Option C dismisses the fear. Option D minimizes the patient's unique experience. 117. The nurse is teaching a patient with COPD about oxygen safety. Which instruction is most important? A. Store oxygen tanks in a hot room. B. Avoid using electrical appliances near oxygen. C. Use oxygen only during meals. D. Keep tanks near an open flame. Answer: B. Avoid using electrical appliances near oxygen. Rationale: electrical appliances can spark, posing a fire risk near oxygen, a flammable gas, making this a critical safety instruction. Option A is unsafe due to heat. Option C is incorrect as oxygen use follows a prescription. Option D is dangerous due to fire risk. 118. A patient with COPD is prescribed Montelukast. What should the nurse teach the patient to report? A. Improved breathing. B. Mood changes or anxiety. C. Increased appetite. D. Weight gain. Answer: B. Mood changes or anxiety. Rationale: Montelukast, a leukotriene modifier, can cause neuropsychiatric side effects like mood changes or anxiety, which should be reported. Option A is a desired effect. Option C is not a common side effect. Option D is less likely with Montelukast. 119. Which finding in a patient with COPD suggests dehydration? A. Moist skin and good turgor. B. Increased sputum production. C. Dry mucous membranes. D. Oxygen saturation of 90%. Answer: C. Dry mucous membranes. Rationale: dry mucous membranes indicate dehydration, which can thicken mucus and worsen COPD symptoms. Option A suggests hydration. Option B is unrelated to hydration status. Option D is within normal range and not indicative of dehydration. 120. The nurse is evaluating a patient with COPD after teaching about medication adherence. Which statement indicates understanding? A. I'll stop my inhaler if I feel better. B. I'll use my inhaler as prescribed daily. C. I'll take extra doses when I'm short of breath. D. I'll store my inhaler in the bathroom. Answer: B. I'll use my inhaler as prescribed daily. Rationale: Using inhalers as prescribed ensures consistent symptom control, reflecting adherence. Option A risks exacerbation. Option C may lead to overdose. Option D is incorrect as humidity can degrade inhalers.